Ambulance service. Is the patient breathing?
We're back on the front line,
West up, better mobilise.
following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby? I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they're going in with shields.
We're expected to dip into everything: mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine. You're fine.
Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time we're with crews in Glasgow, Inverness and Newbridge.
The crew have went to this guy, they've been called to him. It's changed when they've arrived. He's went up the loft and barricaded himself in. And he's got a knife and God knows all what, so. These kind of jobs can go on for hours, They can be protracted. You've just got to go with it kind of softly.
The special operations teams deal with the most challenging jobs in the highest risk environments.
But if he's barricaded himself in, he's got a knife and stuff, then it can escalate. Sometimes public order comes, sometimes firearms end up coming.
So we've got specialist PPE for dealing with weapons. They're stab-proof and ballistic as well, so we've got that added benefit of having them, whereas divisional staff don't have that extra PPE. Often we are the first people who will reach the person that's in crisis. That can be quite difficult for us.
But we'll be sitting pretty much right behind the firearms cops or the public order and provide medical cover for them as well as the patient or public involved.
Oh, this is escalating. Look at it.
I know.
Right in the motors.
Better turn this off. Cheers, mate.
Oh, they're going in with shields. So it looks like it's probably escalated. So that's public order. So public order police are here, so they've got specialist PPE as well.
All right, mate.
Hello.
The house is that way?
So it's just along there to the right.
Oh,
where
right.
the motor is.
Okay.
He's through a petrol pneumatic pile driver out the loft.
Out the loft.
Like, it's massive.
Maybe better put.
Like, and he's a
Is it?
unit.
Is he?
Is he?
He's a big guy.
Aye, I think maybe we better get our vest on anyway.
So because of the nature of the incident, we're going to stick helmet in the ballistic vest, stab-proof vest.
A second SORT crew arrives.
You want suited up?
Stick your vest on.
Both SORT teams get a briefing from Blair, who was one of the first paramedics to arrive on scene.
So we were asked to attend to a fellow whose friend has phoned the ambulance service to say that he's concerned that the gentleman might take his own life. He's heavily intoxicated and he has weapons in the house. And he said there's nothing that we could do to help him. He had made his decision that he wanted to die. I offered him multiple times to phone someone or get him some help. He said no. At that point, police have arrived on scene. He's then got into my face and said, "This is not going to end well for you."
For you?
Yeah. And then at that point, he's told Dee that he's going to end his life and to get out. And then when Dee's came out, he's locked the door. And he's thrown car batteries, a pneumatic drill, countless other things out the loft towards the police. And we were told to back off.
The dog handler's here, and there's a sergeant and an inspector here. And it's just a waiting game, I think.
We've got 2 COVID order officers that are deployed at the bottom of the loft hatch where he's sitting with shields, and we've deployed some negotiators to try and talk to him just to get him down.
Copy, aye.
Thank you. Thanks. Cheers.
It's all to try and bring a safe resolution to the job and try and get the person the help that they need, and not just bomb in there, grab them and bring them out the house, because that's not really going to help
No, it's putting
anybody.
Everybody at risk.
And it's putting everybody at risk, because if they have got weapons and they might harm themselves, they might harm the first person that comes near them. So they've got to try and bring it to a safe conclusion.
Paramedics station's a great station. We're in a town, but there's a lot of rural areas around us, so we travel kind of bigger distances than your inner city stations like Glasgow, so we're on the go all the time. Query cardiac pain in the right-hand side of the chest through to the back.
Okey doke.
Unknown COVID situation, so.
Not a lot of information.
Ivo and Chloe are attending a call from an 82-year-old woman who is suffering pain to her chest and back.
999 mode activated.
Pain that's radiating from the front of the chest to the back. There's many things it could be. It could be respiratory, it could be the heart, it could be
muscle related.
People will say the pain is in their chest, but it's in their upper abdomen. And then we have to kind of determine exactly where it is. But if it's radiating through to the back, if it's coming from the front to the back, it's less likely that that's going to be muscular.
Yeah.
Paramedic Ivo and newly qualified ambulance technician Chloe have crewed together for 4 months.
Everyone here was so welcoming. They're all just brilliant at helping you out, especially as a beginner, so to speak.
Yeah, it's a great training station, and everybody's
brilliant training station.
Jesus, 3 of them, none of them have seen you. Oh my word.
Because it's not even like I've not got the loud sirens on either.
Jeez. I could see none of them were paying attention whatsoever. You could learn forever and still not know all the things that would be great for you to know as part of this job.
Learning, yeah.
But yeah, and things are always changing.
And then I'll pull forward if I need to.
You settle into a rhythm with someone when you're on with them more than a couple of shifts.
Yeah.
You learn their nuances and
quirks.
Yeah, because we've all got quirks.
We're quite good at when we walk into a job, I know what you're going to do straight away. And I can try and be behind you on a lot of things as well. Hiya.
The patient, Patsy, has been in pain since yesterday.
And here? Hello there. What's been happening this morning or beyond?
So I'm bothered a lot with flame and that's it. That's through.
Coughing up.
And so much spit, yeah.
She's been thrown up this morning, it's a bit of bile. She's not able to eat anything.
Right.
She's been up and down all night.
Well, I've got bronchitis, she'll know that. You know.
Okay, so we don't know any of your history at all.
Bronchiectasis is a long-term condition where the airways become damaged and inflamed. The extra mucus it produces can become infected by bacteria.
I remember thinking she was very short of breath, She was a little bit pale, but trying to act like nothing was wrong at the same time.
I was at doctor's last week, and he says to me, because I was in the hospital for November for 3 months, and 3 weeks,
right?
And he says to me, "You do know that you've got a bad heart." Aye, I says a bad heart, but wasn't it thinking my heart's as bad as this?
Right. He didn't tell you what the diagnosis was, no? So tell me about these chest pains then.
It's right down there.
Just all on that one side?
On that one side, and
Right.
I'll tell you, sometimes when the pain comes, I'm hitting the ceiling.
Really, that bad? And when did they start?
That's my mum.
Yesterday.
It's not as common to get right-sided chest pain related to the heart. It could be anything muscular. It could also be just cardiac pain that's been kind of referred over. Quite a lot of people find chest pain across the whole chest, not necessarily to one side. So just chest pain in general, we still treat as potentially cardiac until we can rule it out.
Tell me how it feels. Is it sharp? Is it stabbing? Is it like a pressure?
No,
burning?
it's really stabbing.
Stabbing?
And sore.
Does it go through onto your back as well?
Onto my shoulder.
Just onto your shoulder?
Yes, in fact, my shoulder's sore.
Right,
I don't
okay.
know.
Sharp and stabbing pain is less associated with heart-related pain. It can help us start to differentiate between what we think it could be and lean towards a diagnosis. I usually try and get a good description of the pain, but people aren't always that good at being able to describe, and I understand why.
Oh, it's difficult.
Yeah.
So our daughter being able to tell us that she's had this previous left bundle branch block allowed us to see the ECG and not automatically assume that we're going to have to take her straight up to get a potential stent.
Just breathe normally. I'll let you know if I need any deep breaths, all right?
Our daughter being able to tell us that that is her normal was pretty important.
It's like your lungs are hiccuping inside.
That's right.
I think it's because of all the congestion inside your lungs, and when the alveoli open up and back again, you can hear the fluid popping. Can you tell me any other medical conditions that you've got apart from the bronchiectasis and the angina? High blood pressure?
You get a tablet for blood pressure.
Right, okay.
The crew suspect Patsy has a lung infection.
Because there's a few factors, because of the way your chest sounds, which partially might be normal, but I think it's very much exacerbated at the moment, because of the shortness of breath and the rate that you're breathing at and how much you're struggling. Even if I got an out-of-hours doctor to get you some oral antibiotics to start today, it takes a couple of days for those to properly kick in, and I'm afraid that there might be some deterioration between then.
Might get worse.
Might get worse. So I would like you to see a doctor in the hospital. They can do an chest x-ray, they can take some bloods.
I don't like the hospital.
I know, sweetheart.
I really didn't.
It was because you were really ill the last time.
They'll not keep you in any longer than they have to, okay?
And
the minute they can send you home, they will.
And ultimately, that's what we're trying to prevent, you ending up going in really ill and staying longer.
Okay, darling.
Sorry, darling.
A lot of people are apprehensive about going into hospital, and especially patients
Elderly
of
patients,
an older age, don't want to go in because they feel like sometimes they might lose their independence a little bit, and they know how everything works at home, and obviously there's also that stress of they go in and don't come out.
Yeah. Are these embroidery all yours, Patsy?
Yeah.
Are these all yours?
Yes. Sometimes it costs more for the frames than it does for the materials.
It's really important, especially with patients who perhaps are more reluctant to come to hospital, if we deem it kind of appropriate, is, well, in general, to build a rapport with patients, get them to trust your clinical opinion. You've got some amount of skill, you do.
1993.
She's still doing it. She's not.
Good on you. Thank you, darling.
It's because I'm showing somebody else what to do that I'm doing it. Wait a minute to hold on.
Yeah, no, of course. What I can do is I can move it to you as well if you need to. That's us. Take a wee second.
It's one of the best parts of the job, isn't it?
I know, I love it.
It's just how interesting people are on many levels.
It sounds like a chest infection. She's got a temperature. She's feeling quite sickly, nauseous. There's just there's a couple of things going on that we would want to get checked out.
So do you stay by yourself then, Patsy? With your son?
He's always to the right. He's not to the wrong.
And are you the same?
Oh, she is hilarious. These are the kind of patients we love going to. Just anyone that can make you smile like that, even if they're feeling rotten, oh, they're just wee gems, I think.
Hello. This is Patsy.
My name's David. How can I help you this morning? One of the nurses.
Let me go home.
Let you go home. What's been happening?
The crew updates David on Patsy's condition, and he updates them on how busy the hospital is.
There is delays just now. I don't know how long the delays are going to be. The ambulance crew will monitor you, and if any change your condition, they'll come and let me know. All right? Okay. Also,
Dead quick.
We'll get you sorted as soon as we can, all right? See you later.
Thanks, David. We were waiting about 3 hours with Patsy, which these days has become the norm, certainly in the last 2 years, waiting outside with patients. The impact on the ambulance service is there's less ambulances out there to answer emergency calls. We're all sitting outside a hospital looking after a patient.
Unable to accept any more calls at the time.
Yeah, exactly. So, and that's heartbreaking when you know someone's been waiting a long time and you've just been sat waiting, looking after a patient that needs looked after because there's no beds, there's not enough staff inside the hospital for that patient to come in.
Right, my darling. A couple of wee bumps here. Sorry, Patsy, all right? Thank you.
SWAT crew Lee and Ryan are outside the property of a man who has threatened to take his own life. He has barricaded himself in his loft and is throwing tools and machinery at the emergency services.
At the moment, the police negotiators are in and public order officers are in the house and they're trying to get the fella to engage with them, but in the meantime it's just really a waiting game.
Paramedics have been on scene for over 2 hours. There are now multiple crews attending.
These jobs are a bit manpower intensive. As you can see, we've got 2 resources at this end, a divisional ambulance. There's also a multitude of police between normal police officers, dog handlers and public order, plus negotiators.
These jobs can go on for hours and hours, so sometimes there's a lot of standing about, liaising with police and other agencies.
The crews get an update from the police as negotiations continue.
From those there, he's making references to wanting to die, but not saying he's going to kill himself. So the negotiators are happy that they've still got a line going with him, but not really anything firm to get him down yet. Okay. So it's just a waiting game.
Everybody's mental health crisis from person to person is totally different, so you've got to deal with each one on its own merit. And sometimes we're pretty ill-equipped for it, aren't we? And you've just got to do the best you can and have empathy. And I think if you can understand where the person's coming from and understand what's got them to reach that point, then you're kind of half roads there to trying to help them.
Lee and Ryan's shift has now finished, so a relief crew, Graham and Michael, have arrived to take over.
Please don't see any sign of resolution anytime in the near future.
Yes, sir, that is all received. Thank you for the update.
Pleasure, thank you.
But by 9 o'clock, movement within the house seems to indicate something is happening. Police negotiators succeed in persuading the man to leave the house.
inspector's quite keen that he gets assessed here, but we are trying to do that now. But he's still saying that, so I'm not pushing it. If he said to the cops, if he refuses to travel in an ambulance, we can't legally turn the wheel, in which case they'll step in and sort that out.
Despite their best efforts, the man can't be persuaded to travel by ambulance.
We did try, but we were just getting nothing but verbal abuse and threats of him, so pass it into the care of the police. It's up to the hospital really whether they deal with it under the Mental Health Act or whether it's just a public order incident.
These days, ambulance service personnel find themselves in the middle of a growing mental health crisis.
Just a final update. Passed into care of the police and is now en route, and we are clear. Stand down a little.
No problem at all. Thank you very much for your assistance today.
No problem at all. Happy for Top Gate to be closed down now. Over.
The Scottish Ambulance Service operates 3 control centres where over 1.5 million calls are answered every year.
Is the patient breathing? Oh. Okay, sorry to interrupt you. Is the patient awake?
Many of the call handlers did not start their careers in the ambulance service.
In my previous role, I was an embalmer, preserving and presenting people that have passed away, caring for deceased. I absolutely love embalming. It is my passion. I absolutely love it. It's 2 completely different roles. But I think at the same time, they're both very empathetic roles. You know, they're both really the worst times in people's lives. Having that really empathetic nature and just being really calm for these people really helps. All right, thank you very much. Okay, tell me exactly what's happened.
Today, Natalie is helping a caller who is with an elderly man who has collapsed at a bus stop.
Okay, are you able to get his full name for me and his date of birth, please? So that is an emergency ambulance arranged. All right, so bear with me. Okay, so he's actually at the bus stop. He's not on the bus, he's just near the bus, is that correct? The more information that we have, especially with location, the more accurate it is, the faster our crews that are attending can find the patient and give them that help at scene. And also, the more information we can get about the call and the patient's condition themselves, then the calls will get prioritised at a certain level. I'm organising help for you now. Stay on the line, I'll tell you exactly what to do next. If there is a defibrillator available, send someone to get it now in case we need it later. Do not move him unless he's in danger. All right, okay, and do not splint any injuries.
The patient is struggling to catch their breath.
Just because he's having difficulty breathing, I'm just going to stay on the line with you until that help arrives. If you can just let me know if anything there changes with it at all, okay? Yeah. Sorry, what's happening? Right, sorry, I lost the signal a little bit there. Sorry, you believe he's having a heart attack, is that? Okay, so I just need to ask you some questions. Is he changing colour? He's going purple, okay. And is he clammy or having cold sweats? Right, okay, and does he have a history of heart problems? You've mentioned a heart attack. Oh, right, okay. I think he was like a bluey purple colour, which is a bit like cyanotic, so potentially they're not getting enough oxygen, and that will cause a colour change. So the fact that their breathing is potentially compromised in some way or they're having difficult getting that breath in would provoke a higher response to that patient. Okay, so I'm going to tell you how to take his pulse, okay? I need you to get right next to him. So find the Adam's apple on his neck and use 2 fingers to feel on either side of it for a pulse and tell me when you found it. Okay, so count each beat out loud so I can time you starting now. No, that's great, thank you very much. Okay. Because this gentleman had heart problems, we have an assessment tool on our systems. to help capture that pulse, and that help captures the heart rate, and so that will give the crew an idea of what their heart is doing, what their pulse rate is, beats per minute. If we can try and capture that for the crew before they attend, you know, they've got a better idea of what's going on with that patient.
In case the patient has a full cardiac arrest, Natalie locates the nearest defibrillator.
There's a couple that are close by to you, okay? So there's one at the Tesco Superstore. I can give you a code if someone wants to go and get it. Yeah, if you go get the defib from there, and I'll stay on the line where the patient is, if that's okay. Oh, hello. Has she gone to go get the defib?
But before the caller can return with the defibrillator, the ambulance arrives, 12 minutes after being dispatched.
Okay, you let me know when the crew are right there with you, okay? No, you just let me know when they get out of the vehicle. Is that them there? All right, okay, I'll let you go. All right, thank you very much. Take care. Thanks, bye. As a call handler, you're no good to someone if you're going to get as panicked as they are. You know, it's just going to escalate and escalate. I think if you can try and remain as calm as possible and clear as possible, then you can help them to try and calm down sometimes and also get the best information out of them. Ambulance service, is the patient breathing? Yeah, and is the patient awake? Is she awake? Thank you.
I wish I was a coffee drinker. See on days like this. Yeah.
Lattes, cappuccinos, start small, bigacino.
As well as being crewmates, Chloe and Ivo have become strong friends.
It's one of life's pleasures for me.
Yeah.
Coffee, beer.
Mine's tea and Prosecco, so.
It's been a time of change in Ivo's life. They have recently come out to family and friends as non-binary.
I was 39 when I realised it. I wish I'd realised a lot sooner. It just all of a sudden everything clicked into place. A lot of people will automatically assume my gender. I don't correct patients unless they ask me. Where it does become relevant is my colleagues. Chloe's awesome, always uses they. Some people don't even try. Sex is my body. I have a female body. Gender is here and here, so.
It doesn't affect me at all having to call you they, them. So it takes that wee second of just extra thinking, as some folks say.
But actually it means so much to me because so many people don't even try. So, thank you.
No problem. They're red, so...
Always was a red.
Oh, was it?
A red call is, apart from cardiac arrest, is the highest grade of emergency call. It basically means that we think, from the information we've been given, that it's an immediately life-threatening condition. All the information that we've got is that she is conscious and breathing, and that's all we know. So we don't know what we're going to. Can someone tell us what's been happening today then?
So,
who is it?
This is Nancy.
Nancy. Hi, Nancy.
She's very unresponsive, and it's like her jaw is locked.
Okay.
And
so
it's
kind of drooped to that side.
Facial weakness and speech problems can be signs of a stroke, a serious life-threatening medical condition that occurs when the blood supply to part of the brain is cut off.
So how long did it take to get her awake then?
She's been like that till we come in.
But she's
right. What would be a normal? Did you say she
She'll
doesn't
say hello to you.
All right, so she's not verbal right now, but that's not normal.
No, she's going to be quite chatty and she laughs away. And...
Right. Nancy, would she be able to normally look at me, interact, etc., etc.?
Yeah, definitely.
Nancy, my darling, my name's Ivo. This is Chloe. I'm going to do some checks on you, okay?
She wasn't really conscious, so we were having to assess her level of consciousness. Sorry, Nancy. I'm just going to put a couple of wee wires on you, darling, okay? She wasn't communicative with us at all. Carer said that's not like her. She normally can at least talk to you.
Does Nancy stay here by herself?
Yeah, she does.
So you
yeah.
just came in and found her like that?
Yeah.
What time was someone last in this morning?
9 o'clock.
Just
Yeah,
going on to 9
yeah.
o'clock?
That's right, yeah. Yeah.
About 10 to 9? Right, okay.
And she was fine on
And she was fine.
She was chatting away.
And you left about 10 to 9?
Yeah.
Right.
Yeah.
Right, very quick set of obs, and then we need to try and go.
A stroke is time critical. It's vital to work out when it occurred. Fortunately, Nancy's son was with her this morning.
Left here at 10. You left here at 10, she was chatting and normal, yeah. Right. When we suspect that someone's had a stroke and we know roughly what time that might have occurred, our local timescale is 4.5 hours. That's classed as a hyperacute stroke, and that is something that potentially is treatable by thrombolysis. Essentially, the target is just get them out, get them moving, and if it is confirmed that it's a clot and we know what time it started, give that drug, you can save someone's functionality. What's her history? You finished all the checks, eh?
She's got quite a few medical issues, quite a lot of medication, and she's got vascular dementia as well.
Vascular dementia, okay. So, vascular dementia, any heart problems, any previous strokes? No? At the moment, we'll treat it as fast positive, and she's within a time frame that she can maybe get some treatment, so.
We use the FAST test to determine whether someone has had a stroke. So we focus on whether they've got a facial droop, whether there's weakness in their arms.
Are you able to squeeze my hands? Give them a good squeeze. Can you squeeze on this side? Are you able to lift this leg at all? Can you wiggle this foot? Squeeze this one for me if you can. Nancy.
And whether their speech is off. Any of those, one or three of them, will determine whether someone has had a stroke or not.
Squeeze this hand. Right, Nancy, can you squeeze this hand? Good. Can I just have a quick look in your eyes? I know it's a wee bit bright. Okay, good stuff, thank you. Nancy was making eye contact, so if you asked her to do something, she would respond, but not verbally. Right, we'll just go, we need to go.
The crew leave for hospital 22 minutes after arriving.
4635 requesting standby for an 86-year-old female who is fast positive with speech. She is non-verbal since 10 a.m. this morning when she was last seen well, and a possible left-sided weakness.
It is now 12:40, just over 2.5 hours since Nancy showed signs of a stroke.
We are approximately 7 minutes away. Over. Can you squeeze this hand again? Listen, we're going to look after you, okay? Right, that's us at the hospital. We're going to go and find out where the doctor wants us, all right?
Oh, I'm just behind you.
Oh, hello, hello.
So definite onset time?
Last seen well at 10 a.m. this morning.
Okay.
So, by her son. So normally she's chatty, verbal, etc. Completely non-verbal. Since lunchtime carers came in, they found her difficult to rouse, and she's repeatedly able to squeeze this hand when I ask her to, but not this one. So.
Bring her into this.
Yeah, no, fine.
That's fine.
Although strokes remain a major public health issue in Scotland, the number of deaths has decreased significantly over the last decade.
There you go, my darling.
Road activated.
We're based in Dalkeith, which is good covering jobs in this area. I know it quite well. I grew up here. Scots a borderer.
Yeah, I'm from the Borders, but just work up here. But I've worked here for a few years now, so I loosely know the area. But I enjoy working up here. I enjoy the pace. It's a busy place to work.
In Midlothian, an emergency call has come in for a young boy with a head injury.
Oh well, so we're being diverted to a child. He's been coming down the hill and he's hit his head off a sign.
Oh.
So 6 years old. What a shame.
Kids are good with pain though. I find that. Do you find that? I don't know.
Minorly.
Yours not. Ormiston Park's brilliant though.
Is it like a play park?
Yeah.
Where we're going to?
Yeah.
Hi, pal.
First left, there's a girl standing at the top of the hill where you're in.
Amazing.
Sure, it was just to get you.
Thank you
so much.
Thank you.
Well, I think his dad's appeared now as well.
Oh,
Great.
amazing. We're going down here.
Does he have a helmet on? No. Oh no. Hi. My name's Scott, pal. I heard you've had a wee bump on your bike. What a shame. That's all right, you have to.
You just didn't mind him wear a wee helmet, that's all. No, if you wear a helmet, you'll be fine.
The patient had borrowed his friend's bike, went down quite a steep hill without wearing a helmet and had unfortunately struck a signpost, which was just at the perfect height to catch him on the head. He was cuddled up with his mum. He did have a laceration to the top of his head. I think it was like 4 centimetres or something we had it down as. Yeah, quite a deep. And with it being his head, it tends to bleed quite a lot, so but that had stopped, so that's good.
Because of the nature of Oren's crash, the crew can't rule out spinal injuries. Scott has fitted a neck collar.
Yeah, so the collar's just purely precautionary, just because of the mechanism. So if he's hit that and his head's been sort of hyperextended back, just worry about his neck, which I'm sure is going to be absolutely fine. But just with the pain in the head, it can distract him from any pain there. So yeah, so I'm going to that'll probably be glue. We'll see. I mean, that's really, we'll give it a good clean up and then we'll let the hospital decide the best. What are you saying, pal?
He wants his brother to come.
Oh, yeah. Oh, he's right here. He's right there.
He's rubbing your back.
He can come with you. I'm sure he'll like ambulances as well, eh? Did you get a fright, did you? See, when he came off the bike, was he completely alert?
Yeah.
Yeah.
He just started crying the minute
Straight
he came
away,
off the bike.
perfect.
He's been fully alert all the time.
Good stuff, perfect. He's not been sick or anything.
No,
like
he's
that.
not been sick or anything like that. He did
What a
die.
We had decided pretty quickly that we were going to mobilise
Yeah,
him.
that was
so
pretty
I
much
left,
the plan, yeah.
Yeah, I left and grabbed the trolley and the scoop.
So move your knee in the nicest way possible.
Good lad. Put your head down.
Let's see how tall you are. Let's go, let's go. Oh, you're tall.
Well done. That's just the hardboard there, don't you worry about that. Mum's right beside you, okay? I'm just going to try and keep the sun out of your eyes.
There's a danger that Oren's head laceration could be a distracting injury.
Well done.
That's an injury that causes the patient or the medics to overlook other, potentially serious problems.
Even although he's not complaining of C-spine pain, you've got to also consider that he could have pain somewhere else. 1, 2, 3.
You'll be fine.
Which could then take the feeling of having pain away. So we would normally immobilise somebody that's got a distracted injury. Oh, so it looks like you have to. How are you doing with these shades? You want to keep them on? Fair dues. Right on. So just some little boring checks. We'll pop this on your finger. We'll go for that one.
Before the crew set off for hospital, Scott performs a few checks.
Oren, I'm just going to have a listen to your chest with a stethoscope, all right? Is that okay? Good lad. Perfect. So all these numbers look good, everything looks good. And all this, just total precaution, that's it. This will quickly get taken off. See what's really important. See if by any chance you feel sick or anything when we're on our way in. You're right to tell me, yeah? You're bad. If someone's secured on a scoop, they aren't able to move onto their side, move their arms, anything like that. So it's really important that we're constantly got an eye on that patient. So if they are sick, we want to turn them on their side really quickly so they don't choke on it, basically. We had no immediate concerns and the patient was taken into hospital just under normal driving conditions. He was quite quiet en route to hospital, so that is something we do think about. You okay, Adam? Yeah? You okay? Good lad. But we'll also consider that it's been quite a distressing time for them, so it's quite natural for them to be quiet, to have a wee sleep. But we're monitoring them continuously en route to the hospital, and at that point you can maybe ask some questions just to make sure they're still responding appropriately. Yeah, he'll be fine. As I say, the neck thing is just total precaution, just because he's kind of hyperextended backwards. But he's young, they're totally flexible. I'm sure he'll be absolutely fine.
I feel awful. They wanted the barbecue, so we started the barbecue that night.
He's 6-year-old, and he's at a park. That's what they do. That's these things happen. You'll have a good scar on your head to show folk.
It's like
it's quite deep, but it always looks worse with all the blood because your head bleeds loads. But yeah, I mean, there's no bleeding now. It's not actively bleeding, which is good. Hence why I'm not going to poke about it or clean it now. Now that it's stopped, we'll just leave it to clot, and then yeah, they'll be able to look at it.
Let's get some of these things off you then, eh?
Be sure to get your glasses back because I think he's quite enjoying it.
Oh, he's loving them. But how about we wear them in, eh?
Yeah. Just come with us, yeah.
Good lad. I started in the ambulance service in 2014. It's something that I've always just wanted to do. It's just a dream, and cheesy as it sounds, this is what I wanted to do.
This is one of Kim and Scott's last shifts together. After starting out as an ambulance technician, she's just qualified as a paramedic.
I enjoyed my time as a technician. When I had first started this job, I had said to myself, you know, I had a 5-year plan. By the time it was year 5, I had sort of said, you know, I want to try and do my paramedic at that point. And luckily, that's sort of the way it happened.
They first met when Kim was starting out in the service.
Why are you laughing? When I come out and observing for a day, I was actually paired with Scott and his paramedic partner, Andy, at the time. So it was weird that all sort of happened. Then
we ended up
working together as partners. It was fate.
Is it actually an RTC?
It is. Take the roof off. Take the roof off.
David and Bernie are paramedics in Springburn in the north of Glasgow. Today, they are attending an RTC, or road traffic collision.
Low impact RTC.
2-car collision involving where a 65-year-old male is quite rattled and in shock, apparently, and he has chest tightness, potentially has some injuries.
But this is a green call.
So the critical care desk, your trauma people, have listened into this and deemed it as not serious, life-threatening. So they have downgraded it
to green, so therefore I'll just drive in normal driving conditions.
It's not worth us risking our lives to get to. With Bernie's driving.
Just let you know, one of the CRUs can stop for this RTC, and I think you're just getting to it.
Oh, it's quite dramatic actually. Yeah, put the lights on, put the police on just so we're... All right. Well. Very well, how are you? You having a lovely day? Yes.
When we got there was already a paramedic response unit on scene. So he had basically done the initial assessment of C-spine, initial checks of observations.
He's got no pain or anything.
Good.
There's the blood pressure.
Good.
That's perfect. All he is asthmatic.
The driver, Abdul, had swerved to avoid another car which had pulled out in front of him.
I think the car was pretty smashed up at the front. It'd been said by the police that the patient was not the cause of the RTC. I think they had been skated off to the side of the road.
Hello, Abdul. How are you?
Good, thanks.
What happened?
Well, the car just swerved. There was very short distance between me and her. The car skidded. For this, I tried to avoid her. I'll go to that.
So you did a good job then by swerving out of the way,
Yes,
but there's been consequences for your car, sadly. You don't have any pain?
Not yet.
No. Where do you feel? Do you feel a bit tight or sore anywhere?
Not yet, because my body's warm. Maybe later.
So obviously,
I go an action from the tree. My body go on and come back again. Just feel weak.
Weakness. Well, it's up to yourself what you want to do.
Yeah, I want to go home.
You want to go home? Okay, that's absolutely fine, yeah.
Abdul appears to have no serious injuries, but the crew need to check he is fit enough to leave.
You can get out and stand if you want and see how that feels. Oh, see, there is a bit of something there, isn't there, Abdul?
Hey, Abdul.
Right, take a second. Tell us how you feel there.
Okay.
How are you feeling?
It's okay.
You do feel a wee bit unsteady if I was to let you go. You want to come have a wee lie down in the back of the ambulance for 3 minutes?
Okay.
Yeah?
We could sense that he was in a kind of state of shock, wasn't he? He was in a bit of a trance state. His son was there, which was quite good because he kind of kept the situation for the patient, I think, at ease.
Yeah. Lie down here. That's it.
How are you feeling now that you're lying down, Abdul?
It's okay, there's no pain anymore.
Good. Is it okay to have a wee feel along you? I think he was actually sore. I think he had something wrong with his leg. When I touched his leg, when I was feeling for any injuries, he winced when it touched I think it was his right leg below the knee. I'm going to go back to here.
The airbags and that didn't come out, did they?
But I just don't think that he was interested in attending hospital or anything like that. He wanted to
go home.
Abdul has mentioned he feels weak several times.
Have you had something to eat?
No, I'm fasting. I don't.
Oh, of course, it's Ramadan. I forgot. Yes. I think, you said you're feeling a wee bit dizzy?
This week.
Weak. I think that you should have something today. Okay, especially after this.
The last, my event around 4:30 morning.
Okay, so it's not been too long. There we go. Just relax as best you can.
I know that if I haven't eaten all day, I probably would have had some sort of effect, I would suggest. But maybe we're approaching the end of Ramadan, so maybe he's got some climatisation to it. Right, perfect, Abdul. Should we leave you in the care of your son then? Yeah? Yep, everything's looking nice and normal. Cool. Just saying, just
shock.
No, doesn't want to go to hospital. just to keep an eye on him. He'll probably be in pain, want some paracetamol.
Can you imagine?
And you know, it's he's saying it's Ramadan, it's fasting, but if he's feeling in shock, his body will be tense, so it's probably a good idea for him to get something to eat.
I did say to him, but he's very stubborn, man.
I didn't think he was going to listen to me. That's why I thought I'd say to you. That's why I thought I'd say to you.
We'll get him. We'll get something. So he's fine then.
Absolutely, yeah. But doesn't mean things won't change later on when he settles down.
Yeah. We'll keep an eye on him today and then just see how he is.
Right, just swing your legs round as best you can. That's it.
Careful. Right.
So,
thanks for your help.
No problem. Thank you.
Going down the stairs, just hold on to that bar again, Abdul, okay? David, go down before you.
No matter what happens, people are free to leave whenever they want, unless they are without capacity. So he could make his own decision up at any point if he didn't want to go to hospital, and that would be all right with us. But we checked him out anyway, and he was obliging to us having a check and making sure that everything was good in our books, which was good. Appreciated.
Did he check out all right?
Yeah, his numbers was fine, just a bit.
He's fasting, so I use what?
Yeah, his blood sugars was fine as well.
So that man was fine. He was just a bit rattled, a bit shooken up.
Yeah, quite a fright at the time, I guess.
Yeah.
He was lucky it wasn't more serious.
Yeah, I think his shin was sorer than he was letting on, just to hide it, I think. But that is his choice.
That's the thing, isn't it? You can't really force people to go to hospital and get a further assessment and check-up. Most people just want to go home and see how they feel.
We're not in the kidnapping business.
We're not.
Sadly.
Tommy is an advanced practitioner in critical care. He's responding to a call-out about one of the most vulnerable of patients, a child.
So this is a call for a 12-year-old in cardiac arrest. So not a nice call to get just now. But apart from that, we've got no other details. We've got somebody on the desk, see if there's any significant medical history behind it.
They do elevate my stress levels quite a bit. Nobody likes to see a child very ill or injured, and being a dad myself, it just makes it a bit harder.
Tommy works alone, assisting ambulance crews on complex and demanding incidents.
We just sort of bring some advanced skills in decision making to support our divisional crews dealing with the most critically ill and injured patients. So that becomes our normal job, whereas a divisional crew, that can sometimes be a once-in-a-career job.
We are a good 20-25 minutes away from this one, so the crews will be well established and whatever's happening when we get there.
This is a purple call, reserved for the most serious incidents.
Yeah, so generally 12-year-olds shouldn't go into cardiac arrest. So I can only assume there's going to be something behind the scenes, either some medical problem that they have, or has there been an accident of some sort. That's kind of my thinking at the moment. But yeah, we're kind of in the dark about this one.
During this call, there wasn't much of an update on the way to it. And that just made us assume that the worst was happening.
And now we're stuck in traffic.
It was quite a stressful drive across town. It was very busy on the roads, so having to manoeuvre through traffic.
We're still 10 minutes out. The fact there's been no updates from the crew on scene is quite worrying. It means they're generally really busy. So if it wasn't a cardiac arrest, we would have heard by now. So.
We're the clinical lead on every job we attend. So I do feel that pressure, that expectation to deliver every time. I think the pressure is kind of one of the hardest parts of this job, and then it's just how you deal with that pressure.
Tommy became a paramedic 11 years ago after leaving behind a career in pathology.
I don't know why I picked the ambulance service, but I knew at that point I wanted a job that was going to be rewarding. I wanted to know at the end of my career I'd hopefully made a difference. And yes, it has its highs and it's had its many, many lows, but it is the best job in the world, and I wouldn't change this career choice ever.
We've lost our GPS as well, so we're now running blind.
And I think everybody in service will go through the ups and downs of the job, and you'll find yourself in that dip where you're quite upset with what's been happening. But we get through it. We've all got our strategies for getting through it. It's become a bit more acceptable now to raise your hands and say you've had an issue. We're kind of having a look for the door into the premises, and then the back door of the ambulance opened, and I was met with one of my colleagues in the ambulance who quickly told me it wasn't a cardiac arrest and everything was okay.
Basically, I had a seizure walk about 6 minutes long, started to go a bit blue, so mother then phoned us, but she's not had her meds this morning.
Okay.
So mum's just given them now. Mum's happy, says that she is her normal self kind of thing.
Because you would have failed the respiratory assessment, so that would have been why it was purple and makes us go up to there.
Exactly, we said that because the police arrived as well, eh?
Right,
and we were saying, don't worry about it.
We're all
it's
good.
just, yeah.
Was ready to face a very upset mum. I think we're told the mum was there. So to be met with that was the best thing ever. I remember having that moment of feigning the little collapse and holding my heart sort of thing and having a nice laugh with the crew. So.
Perfect, so she's still upstairs?
In the flat, yeah.
Cool.
In the flat, yeah.
You guys happy?
She's going to Mum does the water to go in anyway and
there
stuff.
You go. Awesome.
Aye.
Awesome, yeah, happy days. Thank you for that. Okay, cheers. I was worried for a second there. Just would have been no update, but we did lose comms during that as well with the computer crashing switch. She's taking her meds now and not going into hospital by the looks of it, which is nice. Good outcome for everybody.